Practitioners have advised the government of Swaziland to consider improving the remuneration of doctors if the country wants to attract Swazi medical practitioners who are practicing outside the kingdom. The doctors said this in a meeting with the Prime Minister. Dr. Barnabas Sibusiso Dlamini was in the company of other cabinet ministers.
Doctors and specialists in their respective fields have pledged to support the government of the Kingdom of Swaziland in her endeavor to improve the health sector. The doctors said this during a meeting with the Prime Minister, Dr. Barnabas Sibusiso Dlamini, alongside other cabinet ministers.
The pay for the local specialists should be comparable to those who are outside the country. We're looking at things like the allowances, which are actually accorded to our colleagues outside the country, whereby if you want to say to someone, come to Swaziland, he or she will be able to tell you, but if I come to the country, these are the things, my benefits I'm going to lose.
So even though the services were fully available at home, we still had some that went back to South Africa. We often ended up with patients with complications, and you're not even aware what was done. You can only try and work backwards to see what was done and therefore figure out a way of trying to correct that.
We need to work hard, whether it's a new council or that is going to be constituted.
We note the draft terms of reference of the task team and applaud the initiative to look into and resolve the issues that will strengthen the health system in Swaziland. As an association, we pledge our ardent support to the process in any way that may be required.
For Swazi TV News, I'm Linton Gule with NS Timabaso at Cabinet.